To ensure patient safety in drug administration, the medical assistant must perform certain procedures every time a medication is ordered. Safety begins with a clearly written order that's easy to read and understand. Clarify any questions you have with the provider.
This is
Never
incoming.
guess.
I just wanted to double check something with you on an order that you wrote for
If you're
Mrs. Wayne.
unfamiliar with a medication, refer to your facility's drug reference to determine the purpose of the drug, common side effects, typical dosage, and any pertinent precautions or contraindications. Be ready for any questions your patient may have. Use the 7 rights to prevent errors: right patient, right drug, right dose, right route, right time, right technique, and right documentation. If needed, perform dosage calculations to match the order. Confirm your answer with the provider if necessary. Dispense the medication in a well-lit, quiet area. Compare the order with the label on the vial to confirm that you have the right drug for the right patient. Check the quality of the medication and the expiration date. Dispose of the medication if it appears contaminated, contains sediment, or has expired. Assemble your equipment. Be sure to choose the correct syringe and needle unit based on the administration site, the patient's characteristics, and the amount of medication to be injected. Remember, you have the right to prevent errors. Compare the order with the label on the medication vial once more just before dispensing the ordered dose. Make sure that the strength on the label matches the order and that you dispense the right dose by the right route at the right time. To mix any medication that may have settled, gently roll the vial between your palms. Don't shake the vial, since that may create air bubbles in the medication. Using a circular motion, clean the rubber stopper with an alcohol wipe. Place the vial on a secure, flat surface. With the needle cover in place, grasp the syringe plunger and draw up an amount of air equal to the amount of medication ordered. Uncover the needle. While holding the vial in place, carefully insert the needle into the center of the rubber stopper. Make sure the uncovered needle touches only the clean rubber stopper. Now, inject the air in your syringe into the medication vial. Without removing the needle, carefully pick up the syringe and vial and invert them. Hold them at eye level and slowly pull back on the plunger to draw up more medication than ordered. While the needle is still in the vial, check for air bubbles in the syringe. If you see any air bubbles, move the hand with which you're holding the vial down to hold the syringe as well. With your free hand, tap the syringe until the air bubbles float into the tip of the syringe. Inject any air bubbles and extra medication back into the vial. Still holding the syringe and vial at eye level, make sure the amount of medication in the syringe unit is still accurate. This confirms that the right dose has been drawn up. Using the right technique, withdraw the needle and replace the needle cover. Be careful not to let the needle touch anything, including the outside of the cover. Confirm the order against the vial label one more time, your third label check. Then return the medication to storage. Finally, dispose of any used supplies like the alcohol wipes. Sanitize your hands. Record the right documentation.